certain fruits can contribute to reduced leg strength, impaired mobility, and muscle fatigue due to their high sugar, potassium, or oxalate content. This article highlights 7 such fruits that older adults should consume cautiously, especially if they are concerned about maintaining lower body strength. Number 1, grapefruit. Grapefruit is often praised for its fresh flavor, vitamin C, and antioxidants. However, for seniors over 50, especially those taking daily medications, this fruit can present hidden dangers. While it may appear healthy on the surface, grapefruit has properties that can quietly interfere with the body's normal processes, especially those related to muscle function and leg strength. Grapefruit contains naturally occurring compounds known as furanocoumarins. These compounds block the action of an important liver enzyme called CYP3A4, which helps break down many common medications, such as those for high blood pressure, cholesterol, and heart conditions. When this enzyme is blocked, the medication is not processed correctly. As a result, the drug can build up to dangerous levels in the bloodstream, even when taken at normal doses. When drug levels become too high, they can cause side effects, one of the most common being muscle weakness, cramping, and stiffness. Over time, this may reduce leg strength and stability. For seniors, weakened leg muscles can lead to slower walking, increased fatigue, and a higher risk of falls or mobility issues. Due to these risks, seniors taking regular medications should avoid grapefruit and grapefruit juice unless approved by a healthcare provider. Even a small serving can have a strong effect. Instead, choosing fruits that do not interfere with medications, like apples, pears, or berries, can provide essential nutrients without the risk of damaging leg strength. Staying informed and mindful of food-drug interactions is a simple but powerful way for seniors to protect their health and independence. No. 2. Bananas. Bananas are commonly seen as a healthy snack, easy to eat, soft, and full of nutrients. They are rich in potassium, vitamin B6, and fiber, which are beneficial for heart health and digestion. However, for seniors, especially those over 50, eating too many bananas can be harmful to leg strength and muscle function. As the body ages, kidney function often becomes less efficient. The kidneys play a vital role in balancing minerals like potassium in the blood. When a senior consumes too many bananas, the high potassium content can become difficult for the kidneys to filter out effectively. This may lead to a condition known as hyperkalemia, which is when potassium levels in the blood become too high. Excess potassium can interfere with nerve and muscle signals, leading to symptoms like muscle fatigue, cramping, and weakness, especially in the legs. Since the legs support most of the body's weight and are essential for movement, any disruption in their strength can directly affect mobility, stability, and independence in daily life. 1 banana a day is generally safe for most older adults, but eating multiple bananas daily, especially without monitoring kidney health, can create an overload of potassium. This risk increases further if a person is already taking medications that affect potassium levels, such as certain blood pressure or heart drugs. It's important for seniors to enjoy bananas in moderation and stay aware of their overall potassium intake. Discussing dietary choices with a healthcare provider can help maintain strong muscles and healthy legs without unwanted side effects. Number 3, dates. Dates are often viewed as a healthy natural sweetener, packed with fiber, antioxidants, and essential minerals like magnesium and potassium. While they do offer some health benefits, for seniors, especially those concerned with muscle and leg strength, excessive consumption of dates can do more harm than good. Dates are among the most sugar-dense fruits. A single date contains a high amount of natural fructose, and just a few can add up to a large spike in blood sugar. For seniors, whose metabolism and insulin sensitivity may decrease with age, these sugar spikes can lead to inflammation, energy crashes, and poor muscle recovery. Chronically high sugar intake contributes to systemic inflammation. Inflammation affects muscles and joints, leading to soreness, fatigue, and weakness, especially in the legs, which are constantly under pressure and strain. When muscle tissue becomes inflamed, it doesn't repair as effectively, and over time, leg strength can diminish. Dates are calorie-dense due to their sugar content. Regularly consuming large portions can lead to weight gain, which places additional stress on the legs, hips, and lower back. For seniors, extra weight and weakened leg muscles can create a dangerous combination, increasing the risk of falls, joint pain, and reduced mobility. While eating 1 or 2 dates occasionally is generally safe, seniors should avoid consuming them daily or in large amounts. Choosing lower sugar fruits like berries or apples can help maintain stable energy, stronger legs, and better overall muscle health. Moderation and balance are key to protecting leg strength and staying active with age. Number 4, canned fruit. Canned fruit may seem like a convenient and tasty way to add more fruit to the diet. It's often soft, easy to chew, and shelf-stable, which makes it appealing for seniors. However, canned fruits are typically preserved in heavy syrup or sweetened juice, which can significantly harm overall health, especially leg strength and muscle performance. Many canned fruits are loaded with added sugars and preservatives. These sugars cause rapid spikes in blood glucose levels, followed by energy crashes. For seniors, repeated blood sugar fluctuations can increase inflammation in the body and disrupt the nutrients required for muscle repair and function. The high sugar content in canned fruits contributes to chronic inflammation, which directly impacts muscles and joints. Inflammation makes muscles slower to recover, more prone to fatigue, and less efficient in supporting body weight. Over time, this results in weakness and reduced strength in the legs, affecting balance, mobility, and independence. Unlike fresh fruit, canned varieties often lose essential vitamins and minerals during the preservation process. Heating, packaging, and added chemicals can strip away nutrients like vitamin C, magnesium, and potassium, all of which are vital for strong muscle function and leg health. For seniors, it's best to avoid canned fruits packed in syrup or sugar. Instead, opt for fresh, frozen, or canned fruits in water or 100% juice with no added sugars. These choices provide better nutrition without the downsides of added sugar and inflammation. Being mindful of how fruits are prepared can go a long way in supporting muscle strength and keeping legs active and strong. Number 5, watermelon. Watermelon is often considered a refreshing and hydrating fruit, especially during warmer months. It's high in water content, low in calories, and rich in vitamins A and C. However, for seniors, particularly those concerned with maintaining leg strength and muscle balance, eating large amounts of watermelon can have unintended negative effects. Watermelon has a high glycemic index, GI, which means it causes blood sugar levels to rise quickly after consumption. While it doesn't contain a lot of sugar per serving, its quick digestion can still lead to sudden spikes in blood glucose. For seniors, whose insulin sensitivity often decreases with age, these spikes can lead to fatigue, energy crashes, and reduced muscle efficiency. While hydration is important, watermelon is over 90% water and can lead to mineral dilution when consumed in large quantities. This means essential minerals like sodium and potassium, which are necessary for muscle contractions and nerve function, can become imbalanced. Such imbalances may lead to cramping, weakness, and instability in the legs. The combination of rapid sugar absorption and possible mineral imbalance can leave seniors feeling lightheaded, weak, or unsteady, particularly in the lower limbs. Over time, these effects may contribute to a decline in leg strength, making daily activities such as walking, standing, or climbing stairs more difficult. While watermelon can still be enjoyed occasionally, it should be consumed in small portions and balanced with other nutrient-dense foods. Seniors aiming to protect their leg strength should focus on fruits that support steady energy, stable blood sugar, and mineral balance. Number 6, mangoes. Mangoes are often celebrated as the king of fruits due to their rich flavor, juicy texture, and vibrant color. They provide a variety of nutrients such as vitamin C, vitamin A, and antioxidants. However, for seniors, particularly those managing blood sugar, weight, or muscle function, mangoes can become a hidden threat to leg strength when consumed excessively. Mangoes are one of the most sugar-dense fruits. Even a single mango can contain a significant amount of fructose. While natural sugar is better than processed sugar, large amounts can still trigger blood sugar spikes. For aging adults, this can lead to insulin resistance, inflammation, and decreased energy availability for muscle repair, especially in the legs. Elevated sugar levels contribute to systemic inflammation, which affects muscle health by slowing down repair and recovery. For seniors, whose muscles are already more vulnerable to weakening due to age-related changes, high sugar intake from mangoes may worsen muscle fatigue, soreness, and cramping, particularly in weight-bearing muscles like those in the legs. Mangoes are calorie-rich. Frequent or large portions can lead to gradual weight gain, which adds more stress to the legs and joints. This increased load may reduce mobility and stability over time, resulting in further loss of leg strength and independence. For seniors, enjoying mangoes in small, occasional servings is the safest approach. It's best to pair them with high-fiber or protein-rich foods to slow down sugar absorption. Prioritizing fruits with lower sugar content and higher fiber can better support strong muscles, steady energy, and healthy aging. Number 7. Pineapple. Pineapple is a tropical fruit known for its vibrant taste and high vitamin C content. It is also rich in bromelain, an enzyme that can aid digestion. However, for seniors concerned about leg strength and muscle function, pineapple can present some risks when consumed in excess. Pineapple contains a significant amount of natural sugars, which can cause rapid increases in blood glucose levels. For seniors, who often experience reduced insulin sensitivity, these sugar spikes can lead to energy fluctuations, fatigue, and inflammation. This inflammation can weaken muscles, especially those in the legs that are crucial for mobility. While bromelain has anti-inflammatory properties, it can sometimes increase sensitivity and irritation in some individuals, especially when eaten in large quantities. This irritation can contribute to muscle discomfort and soreness, making movement more difficult. Repeated blood sugar spikes and inflammation can interfere with muscle repair and strength maintenance. Over time, this may cause the muscles in the legs to become less efficient, weaker, and more prone to cramping or injury. Seniors should enjoy pineapple in moderation and balance it with other fruits and vegetables that support muscle health. Choosing fruits lower in sugar and rich in fiber can help maintain stable energy levels and protect leg strength. By being mindful of quantity and frequency, pineapple can be included as part of a healthy diet without risking leg muscle health. While fruits remain an essential part of a healthy diet, it is important for seniors to choose their intake wisely. The 7 fruits mentioned above are not inherently dangerous but can become problematic when consumed excessively or without considering underlying health conditions. Individuals over 50 should focus on a balanced diet that supports bone density, muscle strength, and joint flexibility. Consulting with a nutritionist or healthcare provider can help determine the safest and most beneficial fruit options based on one's personal health profile.